So, I will introduce Geraldine. Geraldine is a health psychologist, and she's had extensive experience in supporting people adjusting to the impact of a cancer diagnosis and the treatment and life post treatment. So, Geraldine works in a private practice in Auckland, and she's a senior lecturer in the Department of Psychology Medicine at the University of Auckland. And today, Geraldine will explore ways to manage the emotional challenges that we all have of living with cancer. She's going to provide some real practical strategies and tools for you to use to help you navigate where you're at in your journey. So, welcome, Geraldine. It's so lovely to have you with us today.
Kia ora, Paul. Thank you, and kia ora to everyone. Thank you so much for this opportunity. Thank you to Look Good, Feel Better for me to be able to join you this evening from still a very sunny Auckland. And acknowledging everyone who's joined online sort of at the end of what's probably a fairly long day. From the outset, I just want to acknowledge that you are all possibly at different time points on your cancer experience. So some of you may be newly diagnosed, some of you are undergoing various treatments, some of you post-cancer. And I'm really hoping for my presentation today that, as Paul's already said, there's some real practical strategies that you can take away and put into place. And again, as Paul's already said, acknowledging the questions that have come through. So some of what I present, maybe those questions may be answered, but we can certainly pick up on those at the end of the presentation. So Abby, thank you. So as Paul's already said, I'm a registered psychologist. I'm a health psychologist, and I've been practicing now for about 18 years working in oncology. So I've supported many individuals, couples, different family members to really navigate cancer. And I really like the title of this presentation that Look Good, Feel Better have asked me to present on, is actually to navigate cancer with strength, and really think about the psychological tools to cope as you're navigating the cancer experience. So if we could go to the next slide. Thanks, Abby. So for this evening, the overview, my hope is to impart and sort of share with you my knowledge and understanding from, as I said, many years of clinical practice, so that you have a deeper understanding of the psychological challenges associated with cancer, that you'll learn some practical tools to manage your emotional health and well-being. And these tools can be helpful at all stages of the cancer experience. And indeed, they may be tools that would help your partner or other family members if they're alongside you in the cancer journey. And ultimately, hopefully landing that you're able to navigate and go forward with greater resilience and strength. And then at the end, we will land into our Q&A session. Thanks, Abby. Next slide, please. I've got that image there of a roller coaster, and I use that often when I'm presenting or talking to people. And indeed, I worked at the Cancer Society for many years as part of their counselling and psychology team, and we delivered regularly an education talk actually called Riding the Emotional Roller Coaster. And again, acknowledging the first question that we received in sort of preparation for tonight's session was someone who's really keen to actually hear how to manage the emotional roller coaster of the cancer ride, because often people will sit in front of me as we begin to talk and they do this with their hand, and that roller coaster image and analogy is very powerful. So it then becomes about, well, how can I navigate that roller coaster? What are some of the things that I can do to look after myself as I go through this experience? Next slide, please, Abby. Thank you. So the psychological challenges associated with cancer are many, and again, acknowledging that what you see in front of you may resonate quite deeply with many of you. And it's not certainly a one-size-fits-all in terms of the challenges or the experiences that people have, but these are very common ones that we see in the literature, that I see in my practice. So a key thing, and I'll expand on the top one about coping with emotions this evening, is the key emotion is distress. And we know that there are often certain key time points across the cancer experience where distress is quite high. So it's often at that time of diagnosis, as a person's about to start treatment, whether that be going into surgery, radiotherapy, chemotherapy, and then at the end of treatment, often high distress, which for some people feels a bit ironic because there's that relief of finishing treatment, but often people are left with that feeling of distress about what now? I may not have as much regular contact with health professionals. Where to from here? So often we see that peak of distress. A whole range of other emotions, people feeling sad, angry, why has this happened, looking for kind of causal reasons and trying to make sense of their diagnosis. People often feel extremely vulnerable. People will share with me that they go from one day feeling very, very healthy, often not being highly symptomatic, and then they have a screening test or go for some routine test and they're diagnosed with cancer. Catastrophic thoughts, and I'll often talk to people about the catastrophic thoughts in terms of awfulizing a situation or experience. So often people will go to that worst case scenario in terms of outcome or treatment not being effective. Real fears about mortality, and that's often even in the context when people are told that their prognosis is good and there's treatment. The C word lands on most people's lap with a deep shock, and it then becomes about how do I manage that. Anxiety and depression, again, very, very common experiences. Anxiety about treatment, about the future, and depression, low mood, and often people are experiencing both at the same time, so it's not necessarily one or the other. A real threat to personal identity. So it can cause people, in terms of that initial diagnosis, who am I? Because of the changes that come about from treatment and people having to navigate often months of treatment, they have to change their work. They may not be able to parent as effectively as they would like to. There's impacts on relationships, be that partner or family, and relationships with friends. And the real fear of treatment, the fear of recurrence, which I'll touch on a bit more later in tonight's presentation. And then that new normal idea, which is a really common phrase out there in terms of cancer experience. What does it mean like for me post-cancer treatment or going forward? What does normal actually look like? Next slide, please. So I think it's really important when we think about navigating these psychological challenges and certainly the physical challenges as well, and acknowledging that interplay of mind-body connection. So to navigate these challenges, it's useful and important to think about resilience. And it's interesting, I was just saying to Paul as we joined the call this evening that I've presented around resilience a few times actually within the last couple of months to other health professionals and other people trying to understand how they can build their resilience. And it's certainly important for us to think about in the context of a cancer diagnosis and the experience of treatment. So the term and definition in front of you is resilience is defined by the American Psychological Association. And we can think about resilience as a process, so it's ongoing in terms of that building of up the resilience and the strength, and an outcome of successfully adapting to difficult or challenging life experiences. And most people would say, that the challenging life experience of a cancer diagnosis is right up there in terms of challenging all aspects of self. And then it becomes about how do I navigate this? How can I move forward? So challenging life experiences are thinking about mentals that can be psychological, emotional, and behavioural flexibility and adjustment to external and internal demands. Next slide, please. But that can feel quite a weighty, wordy definition, and I think often some of these ideas in front of you may resonate more when we think about what resilience actually means. So it can be about bouncing back. It can also represent, in terms of having to build that resilience through a cancer experience, an opportunity, you could say, for profound personal growth and post-traumatic growth and benefit finding. And those concepts are interlinked for us to think about. Out of the challenge of cancer diagnosis and treatment can actually be that experience of profound personal growth and benefit finding. And again, I acknowledge that may land with some of you in terms of where you are in your experience as, not being able to see that. But often I work with people who are able to make changes, build that resilience, and would often talk about coming out of the cancer experience with a new view of the world. And often that word clarity comes up, where they're able to see things in a different way. And often they don't want to go back to how things were for them before. Next slide, please. So again, acknowledging the couple of the questions that have come through this evening about building that resilience, and one question in particular asking, are there certain things to do at certain times? And certainly some of the strategies I'll sort of go through and talk about as we go through this evening can be beneficial at different times, and I'll kind of allude to that as we go through. So the key components of resilience, we can think about connection. So this can be thinking about the relationships that you have, your connection to your community, and even acknowledging the connection of the Look Good, Feel Better community. Some people look to connection where they join a group or join to do something with other people, because it's often not easy to be making those connections, perhaps say as you're going through chemotherapy, but often it's something that people think about afterwards, or they make the connection to a group like this online. I think COVID has certainly, dare I use the word pivoted the way that we can offer and deliver psychological support to people as they navigate through cancer. Other components is to think about wellness, and this comes under the term of self-care, which again can be, for some, fall as quite a buzzword, but it's actually really thinking about what you can do to look after yourself so that you have, building that resilience and have that strength to navigate through your treatment and life after treatment. Healthy thinking, we need to think about keeping things in perspective, and that can be helpful to think about when I talked about that earlier slide around catastrophic thinking or awfulizing the situation. Often it's helpful, and it may be someone, your partner or in your social network, who actually, maybe challenges you quietly or gently or perhaps more dramatically in terms of what your thinking is, and managing to keep things in better perspective. Purpose and meaning, and this is thinking about having goals. Some of the things that people talk about with me in terms of my clinical work is finding that purpose and meaning. Cancer has challenged me on all these different levels, but I really am wanting to think about what's important to me. Yes, moving beyond even goals. So what are my values? What changes do I want to make? And again, that links into that post-traumatic growth that some people experience after they've gone through their cancer experience. Next slide, please. So if you think about what resilience is, and I'm going to go in shortly into specific strategies to build resilience and think about self-care more broadly, it's important to think about what resilience isn't. And it certainly isn't about not experiencing difficulty or distress. Difficulty, challenges, distress, it's part of the human condition, and you're not letting yourself down, family down, anyone down by actually acknowledging the emotions that you're experiencing in the context of your cancer experience. So it's not about battling on or suppressing or holding on to your emotions, and it's certainly not a personality trait. Resilience can be learned. We can build on often people's existing skills and strengths to make them feel stronger and more able to cope. I want to just kind of add a point here around what often I term as the pressure to be positive as you navigate a cancer diagnosis and treatment. So I certainly work and advocate that you look at working with a strong positive mindset, but it's also okay to acknowledge the less than positive emotions. So sometimes people feel, the person going through the cancer experience and treatment, that they need to keep positive for others. And sometimes that's what they bring to the counselling space, that they're actually able to talk about how difficult it is, how sad they feel, how angry they feel, because there's sort of that pressure to maintain that everything's okay for loved ones, which again is understandable, but it's also important to be able to express those different emotions, or what we might term more negative emotions. Next slide, please. I just wanted to highlight there in the context of thinking about resilience and resilient people. And some of you may have heard of Dr. Lucy Hone. She has a really great TED Talk, which if you are interested in, it's about 14 minutes long, where she talks about resilience. She's a New Zealander and has a book she wrote called Resilient Grieving, which she wrote after the loss of her daughter. And we can think about resilience, in terms of what Lucy talks about, the 3 secrets of resilient people. So it's being open and accepting and understanding that suffering and struggle are a part of life. She asks us to think about, choose where you focus your attention. So often in the cancer experience, it can be about, some clarity for you about where you want to put your energy. Do I actually change my work? What does it mean for me now that I have cancer, that I've gone through treatment? And then the final secret or thing for us to think about is, ask yourself, is this helping or harming me? And that's often thinking about specific behaviours or specific coping strategies which may not be ideal for you. And that may be avoiding emotion, suppressing emotion. It may be engaging in particular behaviours, perhaps drinking more, avoiding sort of connection with others. So that's the big question about, is this actually helping or harming me in terms of my psychological well-being? Next slide, please. So I want to move into some very specific coping strategies. And when people would see me in therapy, a lot of what I'm going to talk through with you now, I would talk through with them, where we think about what could be helpful. And I have, various handouts, because often in session people need to have that backup. They often will make notes, or they don't want to. They just want to sit and talk and be with me. But the idea is that people have something very tangible that they can take away and actually work with. So the first idea is to keep your attention focused on the present. And this really links into mindfulness philosophy or way of being in the world. So in the present moment, what is something that I can do that will make me feel good today? And that may be anything that feels good for you, whether that's a phone call, sitting and looking outside, going for a walk, talking with a friend. The idea with that is to do something that gives you a feeling of regaining or maintaining control in your life, because again, that's a common experience that people will talk about, is control feels very either absent or limited as they go through their cancer experience. Allow yourself a worry time, so acknowledge your distress. I'll expand on that in a moment when I talk about acceptance commitment therapy. And that may be you literally do in the course of your day, say, I'm going to sit and think about some things and focus your attention on things that are worrying you. Sometimes people find it really helpful to write down or journal, again, acknowledging that's not for everybody. Think about periods of activity with periods of rest and relaxation. And this can be particularly helpful when you're going through a chemotherapy regime, is that your body needs time to rest and recover, but you also, maybe want to do some gentle movement, and whether that's a gentle walk or some form of exercise. Also thinking about a relaxation method. And again, there may be some things that you're already doing, but a nice easy one is just to think about focusing on your breathing. And then actually, if you can, in your mind's eye, taking yourself to a place where you feel safe, relaxed and calm, and try to picture that clearly in your head. Next slide, please. Other ideas is to think about, when possible, spend time with supportive people. So just to expand on that a little bit, sometimes that means that you actually need to set some boundaries around the people around you. Often people will say that there's a lot of unhelpful information. When people say that they have a cancer diagnosis, a colleague or a friend says, oh yes, so-and-so had that and they died. Or there's often some very unhelpful things that come up that people are kind of at the mercy of other people's ideas. So that boundary idea is, it may be that you are not answering every text, or actually it's okay to say, look, I'm needing to rest and I can't come for coffee, or you come to visit me. I've already talked about the idea of journaling, so writing down your thoughts and feelings that can help relax your mind. And I really particularly like this one about saying no to non-essentials. And that can be at any time point of your cancer experience, as you're going through treatment, as you come out the other side and needing to, or thinking about work, or what is that new normal for me. So think about, does something have to be done now? Does it have to be done by me? And then accept offers of help. And again, that can be quite challenging for some people who are sort of used to running the household. If you have a family, used to doing all the organizing, etc., etc. And mindful here, as we aren't very far out from Christmas, some people, because of their cancer experience or going through treatment, Christmas might be a bit different. So it might be that you would normally host, and this year you're needing to actually accept those offers of help. Maybe still host, but a lot more contribution from others who may be spending Christmas with you, because you're at a point where it's too much to do what you would usually do. And again, acknowledging there's often a grief and loss around that. So being kind of open to that feeling that things are different. Last one there is thinking about putting your day to rest. And this is something you may want to think about at the end of the day. Some people link in here to the idea of writing down what they're grateful for in the day, 1, 2, 3 things. Some people find that they want to acknowledge something that they've done, because often we tend to focus on what we haven't done. And some people include in that strategy is to kind of write down what they need to do, or what they want to do for the next day. And that can be helpful when you're waking up at 2 o'clock in the morning, maybe feeling anxious or scared about, I haven't done something, or I need to do that. And remind yourself, well, actually, I have made the list, or I do know what I need to do and what I've got planned. Next slide, please. I pulled out in particular about coping with fatigue, because again, that's sort of a flavour of a couple of the questions that have come through for tonight. And it's probably one of the most common, along often with ongoing pain, but fatigue is probably the most common physical symptom that people would experience, and that can continue long after treatment has finished. And when we think about, again, as a health psychologist, I work within that idea of mind-body connection. When you're fatigued, you are going to feel more weepy, often more tearful, sometimes more angry, or those range of emotions that we often don't feel particularly comfortable with. So think about small manageable goals. Sometimes people will share with me, as they're going through treatment, it felt a real win even to answer an email or to prepare some food, because the fatigue is very present and very heavy. I've already alluded to that idea of focus on what you can do rather than what you cannot. So again, that's acknowledging there's so often so much change and loss of your usual routine, what you would usually do, whether that's within your family or in your workplace, or what you would do within your kind of social connections. But there will be some things that you can do, and even if that is a small task or making a small connection to someone, that's important. include rest times when you plan your day. And that can be, again, as I said, we think about across the cancer experience. So resting, the need to rest as you're going through treatment. But even as you're thinking about returning to work or trying to return to some of your usual activities at the end of treatment, your body and mind needs to recover. And that's often quite hard for other people to understand, because it's like, well, you have finished treatment and shouldn't you be back to normal? Shouldn't you be able to do this? And it's important to think about what you actually need. And often that's some ongoing rest. Don't do more than you comfortably can. Exercise if you can. We've got more and more really robust research about the importance and value of exercising, if possible, through treatment and certainly beyond, for both the physical benefit and the psychological benefit. And then thinking about listening to music. Do you like music? Do you want to meditate? Do you want to read? Again, sometimes reading is quite hard as you're going through chemotherapy. In particular, people will say concentration is really compromised. So again, it may be just thinking about what do I need, and what do I need at the different points of your cancer experience. Next slide, please. So I wanted to highlight just briefly acceptance and commitment therapy. We typically would talk about it as ACT. Some of you may have heard of this as a therapy. Some of you may be more familiar with something like CBT, which is cognitive behaviour therapy. In the years that I've been practicing, I've really changed. ACT essentially informs my clinical practice, my psychological therapy. And what ACT really proposes is that within this therapy, we draw on mindfulness and acceptance processes. We make a commitment based on our values to behaviour change, to process and to foster psychological flexibility. So psychological flexibility in ACT, it means to be in contact with the present moment. So this is thinking about mindfulness. It means to be aware of your thoughts, your emotions, the physical sensations in your body, and be open and accept all of them, including the unpleasant ones. And again, that can be the challenge for all of us, but particularly in the context of a cancer experience. Cancer, the word acceptance for people can often be a sticking point, because for some people that means, I like this, it's okay. So I'm not sitting here saying that what you're experiencing in the context of your cancer experience is okay, but to be actually accepting or make room for your feelings. So we'll just go to the next slide just to expand on that. So again, this is a ACT-informed technique to think about steps to emotional acceptance, because there's often that default to push emotion down, and it will come up often like the jack in a box, stronger, and can often feel more overwhelming. So this would be something some of you may resonate with you, and you may want to practice. So observe, bring awareness to the feelings in your body, because often when we talk about our feelings, we do feel it in our body. If we're feeling anxious, it can be a shortness of breath, a tenseness in the muscles, feeling kind of sick in the tummy. Breathe, take a few deep breaths, breathe into and around them. So that's the feeling, the emotion. Expand, make room for these feelings, create some space, and allow them to be there. Essentially trying to make peace with them, because it is part of the human condition, it is part of your experience. And some people find it helpful to silently say, I don't like this feeling, but I have room for it, or it's unpleasant, but I can accept it. So it is about noticing and naming the emotion and making room for them in terms of your experience. Next slide, please. So if we think about fear of recurrence, which again is probably one of the most common psychological challenges, and fear of recurrence, it's interesting. For some people, that starts right from the time of diagnosis. So it may be that you have a treatment plan and you start treatment, and that fear of the cancer coming back starts right from day one. Sometimes people notice that fear arises as they get towards the end of their treatment, or maybe sometime after they've finished their treatment. I wish I had, a magic thing to say or a magic wand to say you're not going to, do this and you're not going to feel that fear. But it's important to say that it's very common. It's not you not coping with your cancer or your situation. As I've said, it's probably one of the most common fears that people have. If we approach the fear of recurrence with that ACT lens, it's thinking about, as I've got listed there, you don't have to like it or want it or approve, simply just allow that feeling, allow that fear to be there. Give it permission and think about living life with this fear. And what often happens as we expand and make room for fear or other less than positive emotions, we engage in a process of diffusion, so they actually don't seem as big and as scary. But fear of recurrence, people will often talk about that they feel they're coping or doing really well, and then they reach a point of a medical check, or they're coming up to a scan, or it's an anniversary of their diagnosis and it pops up. So it is about kind of making room and allowing that fear to be there. Next slide, please. So again, the last couple of bits I just wanted to touch on are about, from an ACT perspective, about contact with the present moment. So it's thinking about mindful exercises, working with the breath, the sound. Sometimes when we get into that spiral of overwhelm, a basic thing like just noticing how your feet feel on the floor, even if you're able to do that now. Notice 5 things you can hear, see, or feel. That can be, again, just what we call a grounding technique, particularly when you're feeling overwhelmed or feeling anxious. So it's really tapping into our senses, and that enables you to be in contact with the present moment. Next slide, please. Within ACT, we talk about values and committed action. I've already sort of alluded to that earlier about thinking about your values. What do you really want? What sort of person do you want to be? What do you want to do with your life? And what gives you meaning? And these are often the big questions that arise in the context of cancer diagnosis and going through treatment, or indeed where it may be an advanced diagnosis or a recurrence, or things have changed in terms of your cancer trajectory. And it becomes about often thinking about what gives you meaning. I'm currently a therapist on a trial for the University of Auckland that's being led by my colleague Dr. Lisa Reynolds and her PhD student Alicia Wells. And we are seeing people with advanced cancer, different types of cancers, and we're looking at the effects of psychedelic microdosing. But we're also delivering a therapy called meaning-centered psychotherapy, which was really developed and grown out of the work of Viktor Frankl. But at the heart of that is looking at meaning in a person's life and the different types of meaning. And that's often very confronting, but it can also be very powerful, particularly in an advanced stage of cancer, and needing to really reflect and think about what your life has meant or what you want to do going forward. Next slide, please. So in terms of a coping plan, it's really thinking about what strategies work for you and acknowledging that you may need to do those at different times through your cancer experience. So if you think about that high distress as an example at the beginning, sometimes it may be as simple as breathing, is thinking about your energy, about getting some support around communication with others about what your diagnosis and your treatment means. So thinking about what to do and when to do it. Who are your supports? And it may be that you have, people to support you. Often people don't have support, or even acknowledging that when you do have support around you, going through cancer can be not quite an isolating and lonely experience. So sometimes there is, an avenue for additional support, whether that be through Look Good, Feel Better, through seeing what different cancer foundations can offer you. Thinking about what maintenance self-care do you use. So what you're currently doing that kind of keeps you going. do you need to add anything? There may be some ideas from what I've talked about this evening already that you think I'd like to give it a go or that could be helpful. Also think about this idea of non-negotiables, and they can be things that you do regularly to look after yourself. They're part of your coping plan. So it can be about making sure you've got some rest time every day. It can be about turning your phone off, because cancer communication or cancer comms can often be very overwhelming for the person to deal with. So maybe you kind of get someone else to handle that or update people in terms of perhaps, for example, how your chemotherapy cycle has gone or the outcome of your surgery. So non-negotiables are, again, it's about boundaries for you, about things that you definitely do that aren't going to kind of drop off the plan. And that can be about connecting with people who are important to you, having time out, doing your breathing or relaxation exercises. And then the last point there is what is your emergency self-care or coping plan? Because many of you may have things that you're doing quite regularly, and then there's a crisis, there's a change perhaps in your health, there's a change perhaps in someone who's close to you, something's happened for them, and because of your overload or vulnerability with what you're going through, things may feel really heavy and really hard. So maybe there's some extra things at that point that you draw on and can bring in to help you navigate crisis or more challenging situations. Thank you. Next slide and last slide. Again, I tend to finish with thinking about seeking extra support when I talk to organisations or do presentations like this, because often people feel overwhelmed or stuck. They're doing a lot of things, a lot of self-care or thinking about what I can do to build my resilience, but they don't feel they're making progress. So this may be a time that you speak to family and friends, particularly if you've been kind of holding that I need to be positive attitude, which again, great place, is really important in that cancer experience. But there's also a definite need to express the less than positive emotions. Speak to a health professional, so your GP, your oncologist, your specialist nurse. It may be that you reach out to see somebody like me in terms of a psychologist, a counsellor, looking what groups are available to you. And of course, they can very much be online. And online support. So here's a prime example of what we're doing together this evening, but look at different resources. What or who can I connect to help me navigate? So just the last slide there, we're moving into the Q&A, and I have just provided my email if there's anything just kind of offline or later people would like to contact me about. I certainly would be very welcome to respond to that. So I will stop there. Thank you.
Wow. There's so much information there, Geraldine. Now, I'm just wondering if we can have a look at the questions. Is there any of those questions that we received that you think that you'd like to read out and maybe cover, yes, Geraldine?
Just bear with me, Paul, because I have those in front of me.
Sure.
And I will grab those.
Okay, that's good. I see some are just typing into the chat box. That's great. Please enter those in.
So, yeah, thanks, Paul. I suppose acknowledging, as I said at the beginning, so the first question about listening and learning how to manage the emotional roller coaster of my cancer ride. I'm hopeful that some of those strategies or ideas I've sort of spoken to this evening would be helpful in terms of thinking about that roller coaster, so that it's maybe not quite as bumpy, or when you feel that you're going a bit lower, you've got some things to kind of get you back up there again. Another question was around tiredness often bringing weepiness, and how can this be managed? And linking back into when I talked about the fatigue that is incredibly common. And if you've got that physical, a deep fatigue, that's different than feeling tired. And that's often really hard for other people to understand. that's going to make your emotions or kind of really trigger that vulnerability or feeling sad. So thinking about how do I address that, or how can that be managed, as some of those ideas about, taking time for rest. It may be that you're a person that is actually really keen to get back to usual activities, often even through treatment, but it's sometimes just recognizing that you need to change things and manage your energy.
Just with that one, I'm
Yeah.
wondering. I had heard, Geraldine, that with fatigue, if you kind of know that let's say you've got 10 hours in the day, and your energy or your bank has got 3 hours of time that you have available, and you talked about planning and thinking about your day. That one of the things to be mindful of is don't use those first 3 hours as soon as you wake up. Like, actually plan those breaks you were talking about. Maybe have half an hour where you want to do some exercise or whatever that may be in the chair or whatever, and then take the rest so that you're not getting way down. Does that make sense?
Yeah, absolutely, Paul. So it is about, yeah, not using kind of all the gas in the tank right at the start of the day. So as you've said, when you're thinking about planning, managing that fatigue or managing, emotions and feelings, actually do some things, and then, schedule in that break. So don't keep going till you are incredibly fatigued or so overwhelmed. So again, and that can come back to just really listening to your body, because it's usually that physical self that speaks to us to say you need to stop, recalibrate, and then you can go back and do something else.
Yeah. No, thanks. So,
Just linking into that though, just one of the questions about being tired 12 months post surgery, is that mental? So it's thinking about, is that psychological, or my body's still recovering? A very short answer would be yes. I think, again, it's often working with that idea that you have gone through a lot, even in terms of what surgery you've had. I'm not sure what type of surgery you've had, but your body takes time to recover. And just trying to work with that idea that, again, it's not you being weak or not doing well in your recovery. That's how you're kind of functioning or rolling, and needing to take that time, take that rest.
because there's both physical and mental, isn't there, Geraldine, in terms of the mental challenge that you're having of that stress and that concern and those kind of things that you have can keep you tired, can't it? It can be wearing down.
Yeah, absolutely, Paul. So you've got that really busy mind, and that is tiring. Particularly, then that will often affect your sleep. So you're waking up at different times in the night, maybe taking a long time to get back to sleep. Or sometimes people say, I have 2 or 3 hours, and that's kind of it for the night. So, doing some work around what are those thoughts, what are the worries, what are the concerns. So you can certainly, from an ACT perspective, be with that emotion, but it can also be helpful to look at what are some of the things that, often it's one or two thoughts or worries that are going around. Could I actually look at that in a different way?
Yeah.
There's a lot of questions in the chat I can see.
Yep.
Someone has said the GP is not allowed to discuss my cancer with me, but I don't understand why. Yeah, that's a interesting one. I probably would need a little bit more context around that. But certainly in terms of your medical records and tests and things, that would be something that you would typically have access to.
Yeah. The next one, when I suddenly become overwhelmed with anxiety, it takes a while to come back to normal. And look, that's very real. I've experienced that myself. And is there something that one could do to immediately slow the reaction down?
That's a great question. What I'd think about tapping into here is just maybe some of that noticing, that exercise around, what can I see around me, what can I even smell, what can I feel, against my skin. That's a grounding exercise, and often I talk to people about using that as they're waiting to go in for that scan, physically kind of at the medical centre or at the hospital, as they're waiting to go in for that medical appointment. So nobody can kind of see or notice what you're doing, but it may be that you're noticing and naming things around you. It may be that you're noticing the emotion. It may be that you're just doing some gentle breathing. Because yes, scanxiety is a difficult one, but having a few grounding exercises to draw on can be really helpful.
Yeah, it could even be a photograph of a grandchild or something to distract the mind. It's a good place. It's very helpful.
That's a really lovely idea, Paul. Or having even a phrase or affirmation or something that you keep on you, to kind of look at in times of rising anxiety and worry.
Staying positive for family. This is something I struggle with, and I find it distressing to upset my family. Staying positive all the time can be exhausting. Yeah, absolutely. Any ideas?
Yeah. Thank you for that question, and that sort of ties in a bit to what I was talking about that pressure to be positive, and it certainly is tiring. What I'd suggest there is, just thinking about just gently communicating how you're feeling. I mean, that can be when we think about family. I'm mindful that may be that you have perhaps younger children, or no children, or it may be that communicating to your wider family. I think at the heart of that, in terms of an idea, is about communicating, which acknowledging that can make you feel uncomfortable in terms of moving out of that I'm always positive zone to actually saying that this is difficult, this is what I'm feeling, and even communicating what you need. It can just be that the person knows how you're feeling. They don't have to fix it, but the knowledge that they understand what your emotional experience is can be really powerful and kind of diffuse some of those feelings.
And the next one is a big thank you to you that have entered into the field of health psychology. Yeah, it's and a real credit to the experience that they've had.
Yeah, that's really lovely to read. Health psychology within New Zealand has developed, over the last 25 years. So we have, for example, the team at the Cancer Society are mostly health psychologists within different hospitals. I am speaking from an Auckland perspective. I really do need to acknowledge that. But we do have other health psychologists who've gone through the training program that I teach on, who are working around New Zealand. And that's quite different from a clinical psychologist.
Yeah, the next one's an interesting one. How to overcome disassociation and be real about being ill.
Again, great question. So that can be, again, linking a little bit to around communication. If you're thinking about that, talking to other people, but also thinking about dissociation in terms of the self and being real to yourself, actually saying, I am unwell, or I'm unwell as a result of the treatment that I'm going through. I am ill, and I need to look after myself and actually take care of myself, because sometimes people do keep pushing and keep trying to follow a routine, as an example, as they're going through treatment, and that can be a double-edged sword. It can be very helpful to have routine and go to work or do some of your usual activities, but it's also important to acknowledge that you are having, very challenging treatment, and it is a need to acknowledge that and to actually look after yourself with support of others, hopefully, as you're navigating that.
I was just going to ask a question, Geraldine. And some of the people will have experienced this. I know in our men's group that people have said that sometimes they've lost friends, and this is quite stressful as well. And others said they've made new friends. And we've kind of talked about this whole thing. And would you say that it would be fair to give friends permission, that we can help the relationship by giving them permission to feel awkward? and to actually not know what to say to us. It's okay. Is
I think,
that something
yeah,
you've through?
yeah. I think that's a great point. Thanks, Paul. Is yeah, when we think about communicating, hearing from someone, I'm here with you, but I don't know what to say. It can be like when someone is experiencing grief, and it's better to actually, or more ideal, to acknowledge what you're feeling in terms of I don't know what to say or I don't know what to do, rather than saying nothing, if that makes sense. So yeah, being open to what you're feeling, acknowledging that you're there for the person, and sometimes the person who's initially diagnosed or at the point of treatment, they don't want you to kind of fix them or try to do all these things. They want you to just be there alongside them, and knowing that you're there, and maybe you do say I don't know what to say or do, that can give you that opportunity to think about things that they can do to support you.
Okay, thanks. I think there's a little bit more clarity here on the one around the GP. They shut me down
Okay.
and said, yeah, maybe you just read that one
Yeah.
from Tracy.
Yeah, I mean, that sounds really hard for the person. Can everyone else see that? I'm not sure, Paul, that question around kind of being shut down in terms of wanting to get more information about your situation. Um, yeah, and that creates that sense of isolation. Yeah, I mean, that may be something for the person that has put that through, that with my email, you might just want to email me. Maybe we could pick up on that. I think that's kind of part of a bigger discussion. But certainly, you do have a right to your medical information. Yeah, so I'm sorry that's happening.
Yeah. And the next one, I can't help feeling that I haven't had or expressed enough feelings throughout my treatment. Now that I've finished my chemo, I feel more emotional, but still try to keep to myself because I can't express what it is I am feeling exactly. Yeah, that's a really interesting
Yeah.
place to be.
Yeah, thank you for the person who put that up. I think it's interesting. It's also quite common in that often people will say they have, just kept on going, getting through treatment, holding on to emotion. They've been in kind of that fight or flight, or I just need to get through this. And then when chemo finishes or surgery's finished, radiotherapy, or sometimes people are have gone through all three, the emotions come up. But it's almost like there's space for them to come out. But sometimes it's hard to actually label what you're feeling. And that can be where you might try to write some things down, talk to trusted others. Maybe that's a point where you want to talk to a counsellor or get some support, or talk to other people who have actually gone through similar experiences in terms of a support group, because that can be powerful and empowering. Yeah, so again, acknowledging common experience, but there are some things you can do to support yourself at that point.
Yeah, that's so true. Many people find that the others get it. There's an association of a common understanding, even though you might be at different stages and so forth. It makes the conversation a whole lot different, doesn't it, Geraldine?
Absolutely, and I encourage people, if they feel comfortable, to connect to other people, through whether that's through groups, or sometimes even with decisions around. I work a lot with women going through breast cancer, decisions around what type of surgery to have. They can connect with other people who've gone through that, and kind of get their shared experience. So very powerful to have that lived experience, and connect to others in that way.
The mushroom experience is a must for all people diagnosed with cancer, and people who have experienced this, they say afterwards, "I'm not scared of dying now." So I don't understand that exactly, but
Yeah, I mean, I suppose if I could just comment on that, is related to the psychedelic
Yes.
therapy around the therapist is that I guess one of the hypotheses or ideas is, does that psychedelic actually open up the person more to the therapeutic process? So in terms of the meaning-centered therapy that I'm delivering, we know that that's a really it's highly researched, very evidence-based, very effective therapy for people with particularly advanced cancer. But the hypothesis, or what we're looking at, and again, I see that study is led by Dr. Lisa Reynolds at the University of Auckland, is could the psychedelic kind of enhance that experience, and perhaps people are more open to the therapeutic process and gain more from it. And that study's still in progress at the moment.
Need to talk to you more about that, Morris. Okay, next one from Tracy. I'm a paraplegic woman. The squatter called cancer taking up space as breast cancer poses some extra challenges. For spinal injury, I can't find another para woman to talk to. The cancer surgeon doesn't understand my unique challenges. I'm in a wheelchair and I have to push myself around.
Yeah, that's extremely challenging, and I think just in terms of trying to find another woman to talk to, I'm not sure whether you have approached an organisation like the Breast Cancer Foundation, or your sort of local cancer society. Again, what you're saying here, it links to that idea of what we just talked about earlier about connecting with others with similar experience, but you're being a person, a paraplegic woman, as you identify, as an extra layer of challenge. So maybe just investigating a bit further, but yeah, acknowledging the physical, extra physical challenge for you through being in a wheelchair.
And finally from Helen.
I was going to say that comfort from Helen around support groups.
Yes, I'm sure there's many online that are part of support groups, and there's many that aren't. And I know the support groups can be very, very valuable.
Yeah, I would agree. I mean, it's important to think for some people it's not for them. Some people connect at different points of their cancer experience, and really just honour that. I think it's a great avenue of support for some people, and it can really just take away a lot of that isolation and loneliness that I talked about earlier, even when you've got really good support around you in terms of family and friends.
I think that's all of the questions, and I'm just conscious of the time. We're now at 6:00, and I do hope that everyone has had their questions answered. Geraldine's kindly left her presentation. But look, thank you, Geraldine, very much. It's been fascinating, very interesting, and it's a massive topic that you tried to cover as well as you possibly can in an hour. And I know you can't do it justice, but I'm sure that everyone has found something of value, hopefully. If you haven't had your question answered, please fire an email through to Geraldine. And I will. You go.
I was just going to say, I will respond to your email. So please do
Cool.
contact me.
Thank you so much. We all hope that you have found something tonight that will be of value to you, that you'll be able to learn about, or maybe a tool or a technique that's going to help you where you are or where you may go.